I'm Vicki Newell, and I manage the Primetime Alive program here at Mary Greeley Medical Center. Our program today is on fall prevention. And as a reminder, if you would like more information about Primetime Alive or to register for a program, you can visit us at mgmc.org/PTA. We have three presenters today. I'm going to introduce all three right up front, and then the order I introduce them now will be the order that they will present. First, we're going to have Celeste Small. Celeste received her Doctor of Physical Therapy degree from the University of Pittsburgh in 2009. As a clinician, she has experience practicing in 4 states in the United States with emphasis on serving individuals with geriatric and neurological impairments. She joined Mary Greeley Medical Center in 2019 and works in the medical arts outpatient therapy clinic. Currently, she enjoys managing patients that are diagnosed with Parkinson's disease, stroke, and vestibular conditions. Our second presenter is Kristen Minkovich. She received her Doctor of Physical Therapy from St. Ambrose University in 2016. She worked on the Mary Greeley Medical Center Acute Rehab Unit for 4 years and has been working as a home health physical therapist for Mary Greeley since August 2020. She is a certified brain injury specialist and a certified OASIS specialist. She is passionate about reducing falls, especially in older adults and adults with neurological conditions. Our last presenter today will be Lisa Haggis. Lisa came to Mary Greeley in May 2004. She received her Bachelor's of Art degree in Human Health Science in 1999 and Master's of Physical Therapy in May of 2000 from Clark University. Professional areas of interest include acute care, early mobility, and vestibular and balance rehabilitation. She is an advanced credential clinical instructor and member of the APTA Acute Care Section and IPTA. I can tell you not often do we have 3 presenters for one program, but if this tells you anything about how important this topic is, we have 3 physical therapists who wanted to take their time this afternoon to share information on presenting falls. So a big thank you to the 3 of them. So we're going to go ahead and get started, and we will have Celeste come up first and start the presentation.
Well, good afternoon, and as usual, I can never get used to this platform, but hopefully we can get back to in person at some point. I'm winking at Vicki over there. Yes, so working in rehab and wellness, falls are really important, and we are very fortunate to have great leadership where they understand the importance of falls and preventing falls. I think 9% of the AIMS population is kind of in the 65 and older category, and those are the individuals that are mostly affected by falls. When we were looking at numbers per our CDC, Centers for Disease and Control, unintentional injuries are the leading cause of death in older individuals. And when we say older, we're talking about 65 years of age and older. And within that, actually 60,000 of those result in death annually, and half of those are as a result of falls. Falls are also the leading cause of fatal and non-fatal injuries. And more importantly, even if you aren't hurt, even if, it's not fatal, it really affects your functional mobility. It affects your attitude. It affects your mental status. So why are there 3 people presenting? Because it's very important. It's important for our community. It's important on an individual level and also just on a non-individual level because it affects how much resources we're pumping into medical expenses. But more as physical therapists, we really understand the impact that it has on the individual, and what we care about is each individual's quality of life and their ability to participate in things that are most meaningful to them. So without further ado, the objectives for this talk really to understand the impact of falls on older individuals. We want you guys to be able to list at least 3 factors that increases your risk for falls. I always say knowledge is power, and our hope is always that you and actually, I'm going to backtrack and say, I've presented this before, and we think that it's important to review this talk because we wanted to offer just a few gems. If we can give you some gems, and knowledge is power, if you're more aware of things that places you at risk for falls and you're able to manage, and even if it's things you can't manage, modifying what you can to keep people, even if it's not you personally, but a loved one, somebody that you're caring for, reducing their risk for falling, we think it's that important. So like I said, just being able to recall at least 3 factors that increases your risk for falls, being able to go on the CDC website and utilize what they call their steady state independent brochure, and being able to utilize a questionnaire that you can, on an individual level, kind of manage your risk factors for falling. We're also going to hopefully provide you guys with 2 resources available through the community to help prevent falls. And speaking of which, on May 19th, we will be offering fall screens. We will have therapists on staff ready and waiting to screen and discuss with you what we see and what you can, take advantage of in the community in terms of maybe it's just maintaining what you have if you're not at risk, but giving you some local resources to be healthy and reduce your risk for being placed in that category. Or if you are at risk for falling, we want to at least be able to guide you in the right direction to address those risk factors. I hear spots are filling up quick. So far, we have about 8 to 9 spots left, but if we get a lot more inquiries to have fall screens done on May 19th, we may be able to open up more slots, so get online and sign up. Also, we would like to identify when it's appropriate to come see us, and even if it's not us necessarily here at Rehab and Wellness, we want to get you to the right place to take care of you. So we would like to just provide some guidance in managing your risk factors or just local resources to optimize your health and well-being. Okay, so per the CDC again, every 3 years, we invest there are about 3 million older adults that are treated in the ER for fall-related injuries. $50 billion are invested in managing those injuries. The average hospital cost for one individual fall is $30,000. And that's just the hospital stay. We're not accounting for resultant disability as a sequela event because of the fall. Also, maybe moving a loved one out of the workforce because they have to care for somebody because they've been injured. So it's just really from the time you enter the ER and you're admitted to the hospital to the time of discharge, it's $30,000, which is a lot of money. Fall deaths have increased. Well, back in 2007 to 2016, there was a 30% increase in falls. And I'm sure with COVID and everybody having to stay home and isolate, people being at home and being less active, I'm sure those numbers have increased dramatically because you're not as mobile, you're not as active. And the older you are, inactivity really comes at a high expense. So a little Q&A, and I'm going to be very honest. I can't see your response, but I want you to participate anyway. So just by clicking a raise of hands on your platform on your computer, how many of you know someone who's suffered from a fall or have personally fallen? And how many of those individuals can you think of that have had life-changing issues as a result of the fall? I know me personally, of course, I work with people all the time, every day that fall or are fear of falling, but have had consequences because of fall. But even on a personal level, unfortunately, my aunt was diagnosed with ALS, and her husband was her primary care provider. What happened? He fell. With him falling, that was a hospital admission, but was that just only a hospital admission for him? But she then required placement because her caregiver was no longer available to provide care for her. So that completely changed the dynamic of that household. And of course, it increased a heck of a lot of medical expenses just because of one fall. So I'm sure you guys all have a personal story where you can tell us about a life-changing event as a result of a fall. Now, how many people are afraid of falling? And I won't dive too much into that, but that's really impactful too. Just having the fear of falling can alter the way you navigate through your environment and have really significant consequences just by being afraid of falling. And if you've suffered from a fall personally, or personally had life-changing issues as a result of a fall. So let's talk about what actually counts as a fall. So true or false? Is it a fall only when you hit the ground? And I can't. So it's kind of funny because when I ask patients, have you fallen? It's interesting to hear how many people say no. Some of you might be on the talk right now. So, and then when they describe what actually happened, and it could be actually hitting the floor, and they'd say, well, the ice was there and I hit the floor, but because the ice was there, it wasn't really a fault. It wasn't really a fall because I couldn't control it because the ice caused me to hit the floor. I didn't cause myself to hit the floor, so it wasn't really a fall. So it's just interesting to hear what people consider falls and what they don't consider falls. So I'd like to tell you, you don't have to hit the floor for it to be considered a fall. So a fall is really defined as any event that leads to an unplanned, unexpected contact with a supporting surface. It doesn't have to be the floor. It could be the wall. If you're walking and you bump into the wall, or you're trying to get out of a chair, trying to get out of your rocker, and you're rocking, and on that third attempt, your butt leaves the chair, but then you fall right back into it. That's actually a fall. Same thing for bed. You're trying to get out of bed, but you just can't get the power to get yourself all the way up and you fall back in. That's a fall. It doesn't necessarily, a fall is not a fall if it's because of an external force, like a push or a shove, or a medical event. So if you have a heart attack, you fainted, you've had a stroke or a seizure, that is not a fall. We usually use the Hopkins Falls grading category, and there are 4 grades to a fall. So the first fall is more like what I would consider a trip. You kind of stumble, but you don't quite hit the ground. The second grade is a fall resulting in you actually landing on the floor. The third is grade 3, where you need some medical attention, but you're not quite admitted to the hospital. That's grade 4. When you have to be admitted to the hospital because you've hit the floor and resulting in significant injury, that's a grade 4 fall. So there are different levels to falling, but they're all considered falls. So the physical consequences of falls, we all hear you don't want to break your hip, so don't fall. So hip fractures is actually kind of the leading injury, accounting for about 37.9%. Loss of mobility, so you fall, you break a hip, you no longer are able to ambulate without using a crutch, a cane, a walker, even a wheelchair. Loss of independence, so no longer able to care for yourself, do your own baths, do your own, getting your own meal preparation, which is a big deal for us. And then it affects your mood. You no longer have that confidence to get out and do the things you want to do with your social groups. And that's really important. Arm injuries are about 5.7%. And unfortunately, death is about 21.8% in the elderly population. So let's talk about fear of falling and why it's important to monitor and be aware of if you are fearful of falling. So what is fear of falling? It's a lasting concern about falling that may cause a person to stop doing activities that she's unable to stop doing activities that they once were able to do. And my computer keeps popping up, so it's kind of throwing me off a little bit. So a lot of people might say, I'm not afraid of falling, I just go a little slower. I'm not afraid of falling, but I no longer go out into winter if it's snowing. And I may need some tech help because my slides are going ahead of me here. And so if you are restricting your activity, if you are restricting your social participation because you don't want to fall, that is a fear of falling. And why is it important? it's important to get out. It's important to be active. It's important to not be rigid in your movements, because actually that fear of falling can actually result in falls. It increases your risk. So unfortunately, there's this vicious cycle of, if you're afraid of falling, you stop moving as much, and the decreased activity increases weakness, and then that results in falls because you're less prepared to navigate different challenges within your community and within your environment. And I would even go a step further and say it increases weakness. The more you sit, the tighter you get, you're less flexible. Being less flexible, your response to challenges in the community, like a curb or maybe a crack in the sidewalk, you're just less agile. And so the less you move, you're more weak, you're less agile, you're just not able, you're not used to, your body's not used to using the strategies that you need to stay upright and prevent a fall. So that's why we talk about monitoring your fear of falling, because the more you know, the more you're able to make better decisions and maybe not restrict your activity as much as you would ordinarily, thinking you're preventing yourself from falling by limiting what you do. There's some negative effects of that as well. So like I mentioned, it may stop you from doing activities, which results in physical impairments, but also socially and just from a depression, anxiety standpoint. We don't want to trigger those and affect your mood. So leg weakness with less activity may cause you to feel depressed and result in some social isolation. And these all places you at a higher risk for falling. So by a show of hands, is the definition of fall different than what you thought it was? I'm sure it is. Does it change your answer on if you've fallen in the past? And did you tell your primary care provider that you've fallen? And do you feel unsteady when you're standing or walking? And do you know a previous fall increases your future risk for falling? So why does a previous fall increase your future risk for falling? It kind of goes back to that fear avoidance cycle where you just stop moving. Especially those falls where you don't quite have an explanation. Those falls where, there wasn't an obstacle that tripped you or a dog that ran in front of you or a piece of, black ice that made you slide. Those falls really affects your psyche. And so that really limits your participation. Once you don't quite know what was the cause of the fall, it affects your confidence and your willingness to participate in activities moving forward. So true or false, are falls a normal part of aging? They are not. We don't expect just because you're older, you need to have a fall. I know a lot of 80-year-olds that are really active. I forgot what it's called. I think I just met a 91-year-old and it's not tennis. I don't remember. It's a similar sport. What's that sport called? Pickleball. And she's like, yeah, I got to get to my pickleball on Tuesdays and Thursdays. And not one fall, 91 years old. So falling is not a normal part of aging. True or false, are falls preventable? They are. So research shows that 60 to 75% of falls can be prevented. And here we go, knowledge is power. So when we talk about fall risk factors, we look at modifiable risk factors and non-modifiable risk factors. So modifiable just meaning, is it something that you can easily change or address? Non-modifiable, we can't easily change or modify those risk factors. And I'd like to take the time to go over those now. So the non-modifiable risk factors that we look at, the older you get, you are at higher risk for falls. That kind of seems kind of contradicting because I just said it's not a normal part of aging. So why is that the case? The older we get, the less we participate in the things we once did before. So, we tend to sit a little bit more. Our posture shifts. And I think I gave a talk about posture and its impact on falling and quality of life in the past. We get to tend to be a little bit more stooped. Kind of what we call our extensor muscles don't work as efficiently. And then our feet, it's harder to pick our feet up because we're so forward flexed. It's just hard to pick our feet up. It's easier to trip. So a lot of things, posture shifts, our muscles are not as limber. We tend to get a little weaker because we're not participating in things that we used to do when we were 30. You're not picking up 2-year-olds anymore as much as you once did. So your muscles are not as strong. We just kind of shift our social engagement and the type of activities we engage in when we're older. Another non-modifiable risk factor is a history of falls. Women are at higher risk for falling. Being on more than 4 medications is also a non-modifiable risk factor. But we'll talk about that. If it's medications that you need, that's one thing, but it's always important to have a dialogue with your pharmacist and your physicians and make sure that you're only on the medications that you need. Poor vision, we can't modify it, but we sure can optimize it by, using corrective lenses. Poor feeling in your feet, like your neuropathy. Whites and Asians tend to be at higher risk for falling than African Americans and Hispanics. Chronic diseases and, of course, memory deficits. I always talk about most falls are multifactorial. This is the hardest non-modifiable risk factor for me to manage when people come to my clinic, just because a lot of times it's all about decision making and if you know your risk for falling, managing those risk factors are really important. And if you can't rely on your cognition to help you manage those risk factors, it's tough. So that's where caregiver support really comes in to play. Modifiable risk factors, physical inactivity. So yeah, we promote a lot of activity. Leg weakness, poor balance. That's a heavy one because poor balance, I can talk about that forever because that's what I do. Improper use of a cane or a walker, that's an easy fix. So when you come for your fall screens, we'll check you out and make sure that you have the right fit. Medication issues and errors, low blood pressure when changing positions. So if your blood pressure is bottoming out once you change positions, there's stuff that your physician or we can talk to you about. When you come and get screened, we'll talk to you about that. Poor vision and care correction, so making sure that you have the proper corrective lenses and also knowing consequences of using corrective lenses. So if you have trifocals, progressive lenses, bifocals, being aware of the impact of maybe negotiating stairs and a curb while using those corrective lenses. Fear of falling, depression, and then of course, social isolation. The less you move, the weaker you get, the more rigid you get. And external risk factors we look at, so stairs, uneven surfaces, wet surfaces, trip hazards, unsecured throw rugs, lack of grab bars in bathrooms, low chairs, surfaces in general, so toilets, sofas, making good decisions by optimizing light, so poor lighting, making sure that you can reach your overhead cabinets, and narrow doorways or paths that limits the ability for you to use maybe per se a walker. So you want to know your risk factors. And like I mentioned, you can go to the CDC State Independent Brochure and take a quiz. And it looks like this. And you can go through and check your risk factors for falling. And we will do that with you if you do come for the screen on May 19th. So if you are at risk for falling, now what? And here's our girl, Kristen. She's going to take over. Thanks for having me.
Hello, yes, I am Kristen, and I get the part of the presentation about what you can do to prevent falls. So yeah, like Celeste was indicating, it's important to check your risk early, check it often. It's better to check your risk before you fall than after you fall. And then you can address any factors you find that would put you at a risk for falls. One reason to see a physical therapist might be if you were functioning at one level and then you see a change from that level that you were functioning to be, less than you were doing before. So a list of fall risk factors you can change today, and then in the future slides, I'll go into each of these in more detail. Be more active. Find something you enjoy. Do it with a friend. Make your home safer. Optimize vision and footwear. Have medication reviewed by pharmacist. Use your walker or cane regularly and properly. And going to a community class or physical therapy to work on strengthening, balance improvement, decreasing your fear of falling. So this slide, I'll talk more in the detail about physical activity to prevent falls. It's important to say before you start any sort of a new exercise program, it's a good idea to talk to your doctor to make sure that the exercise you're thinking of doing is appropriate for you. Try to make it fun, just anything to sit less, just little things you can incorporate into your day, like parking further away from the door, or if stairs are safe for you, maybe choosing the stairs instead of choosing the elevator. I like to do little dance parties with my son when I get home from work. Maybe, you have some grandchildren and you could have a little bit of a dance party with them. Movement can be fun. You might want to consider more of a physical therapist for individualized treatment, especially if you have some more medical conditions, if dizziness is a component of your falls, or if you have dizziness and haven't fallen, that would be a great reason to see a physical therapist. We can really help know the specific muscle groups that need strengthened and provide very skilled balance training that's specified to you. We can work on how you're walking and, work to see what impairments there are with your walking and make your walking smoother and better. And we can also help work on your fear of falling. You could participate in a sort of evidence-based fall prevention program. I think one of the closest things we have to this in Ames is the Walk with Ease program. You could also do more of a group exercise class. If you come to our fall prevention screen, we actually do have a list of some of the exercise programs in the area. And it's always fun to do it with a friend if you can find a friend to help you be active. You can work to change your environment to prevent falls, removing clutter, those throw rugs, if the corner's always coming up as you go over it or it's sliding a little bit, well, can you just remove it? Or at minimum, maybe put some double-sided tape on the bottom to help secure it in place. It can help to have frequently used items at waist level, up high, stepping on a step stool or a ladder. That can cause an increased risk for falls. Even things down low, could cause a little bit of an increased risk. So the more you can keep at waist level, the better. And there's more of this in the study toolkit. If you ever have home health therapy, we can especially, come into your home and really identify some safety things we see and help provide solutions. Vision, you can do some to modify your vision. Getting a yearly eye exam is recommended. A couple interventions you might do, there is an adjustment period after these interventions. Bifocals, trifocals, You know, you want to be more careful, especially doing stairs until you adapt to your new lenses. You may consider having somebody with you on the stairs, maybe increased use of the railing, maybe taking it one stair at a time. Removing cataracts can reduce the risk of falls. A simple intervention is a night light. When it's dark, you can't see as well, so you're at an increased risk of fall, and you can light up the area. Footwear is important in reducing fall risk. If your shoes don't fit well, if your shoes are old, they actually recommend replacing your shoes every 6 months. If you aren't really wearing footwear at all around the home or slick socks, you might consider a grip sock or a slipper. And you might especially consider these things if you're at an increased risk. As Celeste indicated, being on more than 4 medications increases your risk of falls. That's not us telling you to self-discontinue your medications to get down to less than 4. But certainly, you know, everything you are taking should be necessary, should have a reason. You shouldn't start over-the-counter medications without talking to a pharmacist or a doctor about that. Some medications might, you know, cause blood pressure effects. They might make you more sleepy. They might make you more dizzy. If you notice this with any sort of new medications, very important to tell your doctor. You also want to consider using just one pharmacy so that they can have a nice tidy list of what you're taking, asking for an annual medication review. Important to be able to read your labels so you know what you're taking. You may consider a med planner to help you organize your medications. I find this slide pretty interesting. This was actually new to me. Celeste taught me walkers and canes. At least half of older adults who use a cane or walker were never measured for fit or trained properly on use. We have so many great physical therapists, and if you have not been fit or trained properly, we would love to do that for you. So work to come see us. And also 75% of those who fall were not using their cane or walker at the time. So if it's been decided, you know, that it's really best for you to use your cane or your walker, we'd really encourage you to do that, because that's a pretty direct intervention for helping you avoid a fall. Strength, balance, and fear of falling are not 4-letter words. You know, things can be done to help improve your leg strength. Ways you might know that your leg strength isn't as good as it should be is if you notice increased difficulty going up the stairs, getting up from a toilet or chair without using your arms, then you should consider some leg strength. You might know your balance is needing some work if you're feeling more unsteady, seeming to lose your balance more. Physical therapists can be really helpful with both of these. Or you may consider, you know, more of a group exercise program if these are in the really early stages and, you know, you don't so much need that individualized attention, then a community program might be best for you. It's important to have your blood pressure checked regularly, as that can contribute to falling. If you've noticed getting dizzy when you go from laying down to sitting up to standing up, that'd be a good reason to see your doctor. If you notice this, it's good as well to wait a little bit before you go for the next move. So you sit up, you sit there, assess yourself. Am I dizzy? If you are dizzy, wait for that to subside. Then you stand up. Am I dizzy? Wait for any dizziness to go away. And then you walk. You may do some ankle pumps to get the blood moving. And again, this goes hand in hand with medication, especially if it's new, especially if it's a change. Good conversation to have with your doctor. To me, this slide is really just saying when you have changes, your risk for falls may change and may increase. So good time to reassess your risk. If you've changed medications, your health has changed, you have more pain, you haven't been sleeping as well, you feel sad or worried, you've reduced your activity level, you're changing how you're using a cane or walker or starting to use one for the first time, your vision has changed, you've moved to a new home, all of these reasons, would be a good time to reassess your risk and modify the things that you can. And with that, I will hand off to Lisa.
Hello. The place you would find me in the physical therapy world is in the hospital. So I'm going to talk about what to do if a fall happens. But our goal really is to keep you out of the hospital and all of the things that Celeste told you, that Kristen told you, all of those ways you can modify your life to decrease your risk. Hopefully you never, ever get to see me in the hospital. Obviously, when you fall, it's traumatic and your fight or flight kicks in. So while we're going to give you the tips on how to fall safely, keep in mind that we don't expect you to be perfect. There's no way that when you are in the moment, you're going to remember everything. However, if you mentally practice, if in advance of falling, you go through this list and you look at the things that might apply to you, you mentally rehearse the key points. Maybe even you see Celeste at outpatient and you say, I want to practice this. Or you see Kristen in the home health setting and you say, I want to practice this. If you practice, you're more likely to do what's going to keep you the safest during a fall. Like Celeste said, knowledge is power. And right now we're trying to give you the power not only to survive a fall, but to thrive afterwards and get back to your regular life. So please look at this with that filter of what are the gems to you. Celeste opened by saying, we want to give you the gems. I want you to look at this and pick out the things that apply the most to you so you can use them, okay? So you've done everything you can to try to avoid falling, but it still happens. So here's what needs to be done if you do fall. This one seems a little counterintuitive because when you fall, one, you might be upset, you might be scared, and you might feel like your pride's been bruised a little bit because you've actually fallen. But don't get up right away. You need to stop and check yourself. Are you injured? Did you break anything? Are you bleeding anywhere? If your bones and body are not intact, do not attempt to get up. You need to call for help. If you know you've done the assessment on yourself and you know you're at risk of falling, try to avoid situations where you can't call for help, meaning maybe that's a life alert. Maybe you always keep your cell phone or something to call somebody on your person and you have them on speed dial and you have it right there with you. So if anything does happen, you don't even need to call for help. You've got it right. You've got something to access the people you need right away. If you think you've hit your head, and I say this especially to the people that are on blood thinning medications, if you think you have hit your head, it is an immediate medical assistance situation, okay? Blood thinners do increase your risk of brain bleeding, especially on impact. So it doesn't matter to me if you think, oh, I didn't hit it that hard. If you hit your head at all, you need to seek medical attention. And that's important because they can do a scan of your brain to make sure that there is no bleeding and then compare that to a follow-up scan later to see if there was any bleeding. This bleeding doesn't necessarily happen right away. It can be a slow bleed and that can be dangerous. That can be fatal if left unattended. If you live alone in particular, please seek this medical attention because some of the changes that somebody else would notice, maybe you're not thinking clearly, maybe you're sleeping more, some of these warning signs that a brain bleed is occurring, you may not be able to detect yourself because sometimes it takes an outside person to see that. So please seek medical attention right away should you hit your head during a fall. You do need to call your doctor if you fall and talk over what happened. What do you need to do? Does the doctor need to see you? What do you think caused it? And talk that through with your doctor, and so that your doctor is aware that this is happening so that you can follow up. Once you are up and you're safe and all of that happens, sort of have a debriefing with yourself, okay? What caused the fall? Was there a hazard in the way? What do you need to do to prevent falling again? If you can't address those hazards yourself, then you need to call on somebody to try to help you address those hazards. Maybe it's calling a landlord to help. Maybe, darn it, I always trip on that corner of that piece of furniture and I need a family member to help me move that out of the way. That is a problem. Get people involved that need to be to make sure that you've set up your environment to reduce those hazards. As far as getting up goes, this is where Celeste and, of course, Kristen come in. We don't do a lot of getting up from the floor teaching in the hospital. Most people at that point are not in a condition that they can get down to the floor or back up. But Celeste and Kristen are really important for you, that learning of how do you get up after a fall. Okay, so let's talk about the right way to fall. Again, I know that you're going to be not necessarily thinking with your rational brain. Your fight or flight is kicked in, but if you practiced and thought this through, you're more likely to fall safely. But let's talk about what you should not do. Don't pedal with your feet to try to catch yourself. It can lead to broken bones in your foot or your ankle or a rolled ankle. Okay, and you're really trying to not fall directly onto your knees or directly onto the outstretched hands. So that's the one at the bottom that says avoid foosh, falling onto outstretched hands. So we're talking about this. When you fall and put your hands out, think of somebody in all fours. I don't think there's any way I can accomplish that on this particular medium of talking to you. But when you do that, all of the force is going through a very small surface area, whether that be your hands or directly onto your kneecaps if you're falling onto your knees. And you're very likely to break a wrist or a kneecap. So you really want to avoid that. Falling straight forward or backwards will increase your likelihood of damaging your spine or vital organs. So you really want to try to fall more onto your side, which takes us into the do's of falling. When you do fall, you want to protect your head. You want to pivot and roll into it best you can. If you find yourself extending an arm to catch yourself, try to roll into it and let that arm bend as you go so you're not taking the brunt of the force and you're rolling into the fall. You want to fall onto the fleshiest parts of your body. So we're talking outer hips, outer arms. I like the phrasing in there of roll with it. Just roll with it. You're going to have to go with the flow on this one. Breathe out, relax as much as you can, and just go with the force. Don't try to stop it. That's when we get broken bones. I think Celeste calls it the tuck and roll, where you're just trying to roll into the fall and let that momentum and that force be dispersed throughout as much surface area of your body as you can, rather than trying to stop it with one point like a hand or a knee. Okay, so trying to summarize that because there's a lot of points there. Spread the force of the impact. Okay, looking for fleshy parts so that you're dispersing all of that force to avoid breaking. The more you relax, the more you exhale rather than getting rigid, the better off you'll be. The more force will be impact. Rigidity is your enemy. Pliability is your friend. Just roll with it. Also, the better physical condition you're in. The physical therapists have both. All of us up here today have mentioned this. The more you move, the more agile you are. The stronger you are, the more activity you're a part of. It's easier to manage during a fall. And again, this is where physical therapy can be your friend. We can intervene. We can teach you different strategies and do different activities to do so that when a fall occurs, your body's ready to go, and you're gonna come through it. So this is the sum in summary. Okay. We've talked about older adults are at increased risk of falling. While it's not something that has to happen for an older adult, it does increase your risk. You need to talk about your fall risk and come up with a prevention plan with your healthcare provider. Maybe that's your doctor, maybe that's your therapist, but you need to have a plan ready to go. Know which risks can be modified, okay? Check your home for safety. Discuss those risk factors, modify what you can to create the safest environment you can for yourself. Vision is a part of balance and falling. You want to make sure that your eyes are working. That's one of your balance systems. So have those checked at least once a year. And exercise. Exercise really improves your balance and strength and is so important as we age. That's a lot of information, so where do you even get started? Pick one thing, okay? My mom always said, how do you eat an elephant? One bite at a time, okay? So pick one thing from today and get going on it. You can talk to your pharmacist or your doctor. You can review your medications. A lot of the side effects of medications can be lightheadedness, can be dizziness, can be things that could lead to an increased risk of falling. So talk that over with your pharmacist and doctor. Is there something else you could be on that didn't have those side effects? How do we balance your need for those medications with your risk of falling? You can talk to an occupational therapist. They can do a home assessment and they can make recommendations to make your home safer. Our home physical therapists can do that as well. Or working with your physical therapist to increase your activity level, improve your balance, improve your strength, and learn how to move safely. Once you've talked that through, make the plan, okay? What are you going to do to prevent a fall? Okay, and make a goal, okay? And we've given you a few examples of what some of those goals can be so that you can start modifying your plan, making a plan, and reducing your risk of falling. And remember, move more. The more you move, the healthier you are. As a therapist that works in the hospital, the times we see people coming in with those grade 4 falls, remember, a grade 4 fall means you end up in the hospital. We see them, first snow of the year, somebody goes out and slips and falls. Okay, the spring thaw out, black ice, we see it then. But I'm going to tell you the other times we see a spike of falls with injury in the hospital is the first nice day of the year. And why? Because all winter people sat inside in Iowa and didn't do anything. And then they got up on the first nice day of the year and went, I'm going to go outside and pick up my yard or just walk around the block. And their body wasn't physically prepared for it. So move, 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 move. Can't say that one enough. I'm not sure how we're doing the questions section, but that will be coming. And then there's a few more slides at the end that have resources if you like to take a deeper dive and look at some of those websites that have been put together by the physical therapy geriatric section. Those are all excellent resources too if you want to take a deeper dive than what we presented today. Thank you.
All right, so far, we basically have some comments from people, and that I don't know that those are ones that we need to share. But what we will do is, I would imagine there are potentially a lot of questions today. And I'm going to kind of go on and let you know about the other program we have still this month. And Celeste talked about it a little bit. First of all, thank yous to Celeste and Kristen and Lisa for the great presentation today. My goodness, lots of really good information, great handouts. I know people will take lots away from this. And as was talked about during the program, we also piggybacked on this program some fall and balance screenings. They only take about 15 minutes, but you do need to pre-register for them. And unlike our online programs, these are in person, and these you do need to call our office to sign up for them. So the program is Fall and Balance Screenings Thursday, May 19th from 9 a.m. until noon every 15 minutes. And many of those are filled, so it's really more mid-morning where we kind of have some times. But if we fill up, we may be able to add some more time, so call soon, please. It's going to be in Atrium A, which is on the second floor right across from the entrance to our cafeteria. You will call 515-239-2423. That is our regular Primetime Alive number, 515-239-2423. And as of right now, I am not seeing any questions, and I think that's because your program was so thorough today and answered so many questions. But if you do have questions, you can email them to me, and I'll get them onto the, pass those along to our physical therapists who are here today, and we'll shoot those answers to you. Oh, then I also wanted to tell you that program that's the only other program we have this month. We did have a program scheduled for May 18th, talking about talking about Pinterest and all of the great things you could do. The same presenter was also supposed to present in April, and she's had some things coming up. We need to reschedule her for later this year. So if you are signed up for Wednesday, May 18th, the program on Pinterest, that will be rescheduled. So once again, thank you to the three of you, Kristen and Celeste and Lisa, for presenting today. Thank you for joining us, everyone, and have a great day.